Weekend kicks off National Bone and Joint Health National Awareness Week. So here to talk about natural ways to strengthen our bones and joints through exercise is Dr. Robb from Fix24 in North Phoenix. Good morning. Thanks for waking up with us.
Thank you for having me.
Okay, so let's talk about bone and joint health and what we can do. I guess it's probably pretty important to be proactive about taking care of yourself.
Two things that make up bone and joint health. Number one is going to be calcium, of course. We get calcium from our diet and our dark green leafy vegetables, but most important is taking supplements. Most of the food that we consume nowadays are depleted in nutrients, so that raises the need to supplementation. And calcium carbonate alone is typically what's found in most over-the-counter supplements. It's not enough.
So if somebody out there says, you know what, I just don't really take my vitamins. I know I should, but I don't. And I eat salads a couple times a week. It's just not enough?
It's not enough.
Really? Okay.
And also the type of calcium that you take. Calcium carbonate is a basic form of calcium, and it's like sticking a chalk in a glass of water. It won't absorb. So we have to bind different things to that calcium to make it get into the bones and make it more effective.
And ultimately, why is it so important to be taking such good care of our joints and bones?
Well, the main thing is, and when I lecture all over the valley, I talk about, and I always close every lecture that I talk about with, when you lose mobility, you lose your health. And so maintaining proper movement and mobility in the spine comes from maintaining healthy bones and joint alignment.
Okay. Now, are these some of the supplements that you were talking about?
Yes.
Some of the ones that you recommend?
Right.
This would be something you take, what, once a day, twice a day?
This is from Biotics Research Company. This is a vitamin D3, which I suggest my patients about 6,000 IUs a day. Vitamin D3 is not just for bone health, but it's also immunity. So this time of year when we have issues with flu and colds going around, vitamin D3 and boosting it up to about 6,000 IUs will really help with that. This is the standard calcium magnesium supplement, which are two major elements found in bone.
Okay.
And then this is just an additional or a different type of calcium.
Now, what about exercise? If you get out there and you're active, how much can that help?
Well, we know that stressing the bones increases density. That's why the advice of exercising to improve bone density can happen at any age. But when you stress the bones through a process of bone remodeling called Wolff's Law, then the bones will thicken and create a healthier joint. Okay,
now I have about 15 seconds left. I have to ask you, lots of runners out there and hikers, can that actually do more damage than good, or is that okay? That kind of...
Great question, and this was notated in Time magazine. It said that runners are at no greater risk of arthritis as long as the joints are properly aligned.
Okay, even more important to take the supplements, I would imagine. Okay, thank you so much for being here, Dr. Robb.
Thank you for having me.
Very insightful. Okay, and we want to give you his contact information. There is the website right there, Fix24.com, and the phone number is 480-419-1500. Appreciate your time this morning.
Thank you.
Have a great one.